Hello, and welcome back to Chatting with Behavioral Health. I'm Cassie Uberheim, a licensed marriage and family therapist. In this episode, I want to begin the discussion about the racial injustices that are happening and ways to cope. First off, I would like to identify privilege. It's a special right, advantage, or immunity granted or available to only a particular person or group. I, as a white woman, would love to use my privilege to be an ally and to illuminate the issue, and to further educate the community about my awareness of privilege and how it has impacted the Black American community both in the past and currently. There are a lot of feelings circulating right now. I want you to know that it's okay to feel sad, to feel upset, enraged, hurt, hopeless, and maybe completely exhausted. Allow yourself to feel your feelings without the judgment from others. Your feelings are valid. So let's discuss how to cope with these feelings, manage your stress, and maintain your mental health. I encourage you to practice mindfulness and self-care. This may include meditation, cooking a healthy meal, or even just getting outside. In addition, don't be afraid to set boundaries with others. This is a big piece of self-care. Allow yourself to enforce a boundary or a limit with someone who is draining your emotional tank. It is okay to prioritize your well-being because you can't be supportive to others if you're not okay. And you can reach out to others who are able to provide the support, such as a family member, a supportive friend, or therapy. If you need to, step away from the news and social media. Yes, it's important to stay connected, but in moderation. Get important updates, but only a few times a day. And make sure you're listening to legitimate news sources. It has been found that an increase in social media use is related to a decrease in mental health. I'd like to shift to discussing trauma and its effects on mental health. Individual trauma results from an event, series of events, or set of circumstances experienced by the individual as physically or emotionally harmful or life-threatening. It has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. While trauma can come from an individual level, it can also be found in systemic trauma, PTSD, re-traumatization, and generational trauma. Racism and discrimination are both examples of trauma. It can leave someone feeling discounted and lonely. It can lead to a decrease in hope in the future, in justice, or in the government. It can lead to an increase of having to be in survival mode. It can lead to a decrease in trust, and it can leave someone feeling powerless. The trauma must stop. The discrimination must stop. The racism must stop. So what can we do to make sure that it does? Here are some simple action steps that you can take. First of all, humble yourself. Be willing to learn and be curious. It's okay if you make a mistake if you're coming from a place of compassion and a willingness to learn and receive valuable feedback. Also, be an ally. Listen to the voices of people of color, listen to their experiences, provide empathy, and provide that safe space for them to express themselves. I want to leave you today with a statement from Behavioral Health Department's Director, Ann Robin. The Behavioral Health Department is here for you to support you and your loved ones during this trauma.